We take a deeper dive now on the Biden administration's efforts to combat the Delta variant with Surgeon General Dr. Vivek Murthy. Dr. Murthy, welcome back to the NewsHour. Always good to have you here. Help us understand now, this is confusing for a lot of people. We know that masking helps to contain virus spread. So why not change the masking guidance so that more people wear them now?
Well, it's a great question, Amna. So let's review what we know. We know, yes, that masks are helpful in preventing spread, but we also know from the science that the CDC shared about 2 months ago is that if you are fully vaccinated, your risk of getting sick or transmitting the virus is low. Now, there are circumstances where individuals may want to consider wearing masks, where counties may decide to put mitigation measures like mask requirements back in place. And those would be, for example, if they had a lot of virus circulating, as some communities do. If you're an individual who maybe has kids at home who are not vaccinated, or you yourself are immunocompromised, those are all circumstances where counties or individuals may decide that they want to wear masks again. I actually think that in a moment like this, when we're seeing COVID spreading so widely because of the Delta variant, that it's prudent to err on the side of caution, because again, a lot of people are getting infected right now, primarily unvaccinated. But again, bears being cautious depending on your situation.
So what do you do about areas where you have leaders, where there's a large amount of COVID and spreading right now? Florida, for example, where you're joining us from, is one of the highest COVID rates in the country. Governor DeSantis has said he opposes any mask mandates, especially when school restarts this fall. What do you do about those areas?
Well, what I can just tell you from a public health and science perspective is what we've learned, which is that the masks help. And that especially when you've got a lot of virus spreading and you don't have high vaccination rates, which is the case in parts of my home state of Florida, that masks absolutely can be a useful tool. And look, I understand that people are tired, of so much of what we've dealt with over this past year, wearing masks, not seeing your friends, just going through the uncertainty of COVID. It's been exhausting for all of us. And we've made a lot of progress, but this is one of those moments, Amna, with the Delta variant spreading so quickly, that we've got to take measures to reduce spread. And vaccination is important. Like, we've got to vaccinate people quickly, but if you're trying to reduce spread in a short time frame, in the order of days to weeks, then it is measures like masking and distancing that are among our most powerful tools.
But Dr. Murthy, the Delta variant was spreading back in mid-May, back when the CDC chose to relax that masking guidance. In hindsight, looking back now, was that a mistake? Did that send the wrong message, that we were past the worst of it too soon?
I think the CDC made that decision because at the time, the cases were actually dropping significantly. The science was telling us that fully vaccinated people were, in fact, quite well protected. Nothing's 100%, but that the risk of infection and transmission was low. And I think what the CDC was also seeing at that time was, yes, there was Delta, but it was at very, very low levels at that time. What we've seen since then is Delta has really surged. It's more than 83% of cases that we're diagnosing of COVID right now. But what the CDC is also saying here is not that people shouldn't wear masks, but what they did 60 days ago is give counties and individuals the flexibility to determine when they used masks based on their risk tolerance and based on how much infection was in their community. Now, one of the things that we're seeing is as our vaccinated population is increasing, we're seeing COVID become a more local and regional phenomenon. The whole country is not flaring at once, but we are seeing rises and surges in pockets where the unvaccinated population is high. I think it makes sense to direct mitigation measures to those areas. And for counties that are putting mask measures in place because they see infections rising, I think it's a very reasonable step to take.
So the vaccination rates have plateaued somewhat, right? We're about 500,000 or so a day. 56% of the eligible American population has now been fully vaccinated. So what for you is the goal? What percentage do we need to get at where you say we're at herd immunity, we have a more comfortable level now where that virus spread can slow?
Yeah, so Amna, this is like the million-dollar question. And I use the proof is in the pudding example, which is that I don't think there's a specific number that we're targeting because, quite frankly, we don't know what that number is because it changes based on how contagious the virus is. And now we're dealing with a more transmissible variant, which means the quote-unquote number you need to reach herd immunity is actually greater in terms of percentage of the population vaccinated. But here's how we'll know we got there. When cases come down and stay down for a sustained period of time, we will know that we're at the point where we've hit a good vaccination target. We are not seeing that yet in the country. And while some areas are actually doing pretty well that have greater than 80% vaccination rates, in many other parts of the country we are seeing surges among the unvaccinated. Now, one really important point, though, that is, I think we got to make sure everyone understands, is that the increases in cases we're seeing is not evidence that the vaccine doesn't work. Quite to the contrary. What we are seeing is that 99.5% of deaths from COVID now, 97% of hospitalizations are among those who are not vaccinated, which means, again, if you are fully vaccinated, you are well protected against the worst outcomes, severe illness and death from COVID. That's why it's still so important for people to go out there and get vaccinated.
You have said repeatedly, officials have said repeatedly, you have to get the right messengers to those people who are unvaccinated. And recently, we've seen a number of Republican lawmakers in particular who were previously largely silent on vaccinations, now publicly speak out and urge people to get vaccinated. But we are still, in terms of our vaccination rates, now lagging other countries that we were once far ahead of. So is all of that a sign that even that messaging shift isn't really going to make a difference?
Well, I think every person who speaks up influences the people who believe in them. And I think seeing more political leaders step up to do that, seeing leaders in business and in education step up, seeing faith leaders increasingly step up in their communities to talk about the importance of getting vaccinated, I think this is actually very promising. Now, it takes people a little bit of time to absorb those messages and then to make the decision to get vaccinated. Once they get vaccinated, it takes several weeks for them to actually increase and get the protection that they need from the virus. But I think this is overall very encouraging. This is what we need to keep doing more of. The thing to remember here is that as powerful and as important as doctors and nurses are as messengers, we actually have recent data that tells us that all of us, family members and friends, can be powerful messengers as well. 1 in 5 of people who were on the wait and see category, if you will, as far as vaccines are concerned in January, made the decision to get vaccinated and got vaccinated. And when asked what changed their mind, they said it was talking to their family, to their friends, seeing their family and friends get vaccinated and do well. So I say that to remind everyone that in this phase of the vaccination campaign, it is up to us to also talk to our family and our friends, those who trust us, ask them if they got vaccinated. And if they haven't, have them go to vaccines.gov to find a place, help them answer questions. But we've got to help each other get vaccinated. That's how we're going to end this pandemic once and for all.
Dr. Murthy, lastly and briefly, if I may, you have said that the social media companies, the tech companies you've been in touch with need to do more to stop the misinformation that's out there and keeping people from getting vaccinated. What specifically else do you want them to do that would help to end the pandemic sooner?
The reason I issued a Surgeon General's advisory on health misinformation last week and called on technology companies and other stakeholders to do more is because health misinformation is harming our health. It's all of us have we deserve to be able to make the right decisions for ourselves based on accurate information. A lot of people don't have that. There are 8 things that we laid out for technology companies to do, but a few that I'll mention to you here are: number 1, acting more quickly to get disinformation reduced on their site. Number 2, changing their algorithm so they don't continue to serve up more and more misinformation to people and encounter it for the first time. And third is being more transparent with their data so we understand how much misinformation is actually being transacted on their site. When they say we've removed X number of pieces of misinformation, that doesn't mean much if we don't know, how many actually existed on the site. 4 million out of 4 billion is very different from 4 million out of 5 million. So we need more transparency. We need them to make more product changes to reduce the spread of misinformation. They have the ability to do that. We just need them to act with greater urgency because lives depend on it.
That is the U.S. Surgeon General, Dr. Vivek Murthy, joining us tonight. Dr. Murthy, always good to see you. Thanks for the time.
Great to see you, Amna. Take care and be well.